Health officials are explaining that data cleaning exercises may have led to a bit of confusion regarding the latest COVID-19 figures, hence the need for cases to be reclassified. The numbers initially suggested that there were no new cases in New Providence. However, a revised dashboard showed that 4 new cases were in fact recorded yesterday. The dashboard also showed Eleuthera with 10 new cases, 6 in Grand Bahama, 5 in Exuma, 2 in Andros, and 1 in Abaco. We spoke with Deputy Chief Medical Officer Dr. DeLon Brennan on the changes.
We ended up having to reclassify a number of individuals who were first assigned to New Providence to Exuma, which was actually likely the place where they had been exposed or where they lived. And so in that reclassification, we had to move a number of persons, so that decreased the number of persons from New Providence, and that decrease in number was more than the increase in the number for New Providence for that day. So it appears as though we actually decreased the numbers in New Providence. And so when you looked at the math, it really just changed the numbers some. So we just made a clarification to make sure it didn't look like we had no cases in New Providence for the day, but that we actually did have cases, but it was less than the reclassification.
Now, Dr. Brennan says he's pleased that the COVID numbers are headed in the opposite direction than they've been over the last several weeks.
It's a positive sign that we're starting to see those numbers trend down. I think that is a combination of a number of things. We had the restrictive measures that were put in place in New Providence, and then we have the public, take it upon themselves to realize that this is a very concerning issue for us here in the Bahamas. So we need to make sure that, they take the right measures. And in doing so, in combining those two things, the decrease in the numbers goes along with that. We often hear the issue, people talking about a decrease in number of tests, along with, the decreased numbers of positive cases. But we also like to let people look not just at the pure numbers of people who test positive for the day, but look at our hospitalizations, look at our deaths. You'll see all of them are trending downward.